Okay, so in this lecture we're going over health insurance and how health insurance works in the United States. So there's sort of two goals with this discussion. The first goal is that you know what the Affordable Care Act means, like what it actually does, so that you are familiar with Obamacare and what is in Obamacare. And the second goal is to introduce you to the basics of how health insurance works. You won't be able to understand Obamacare if you don't actually know how health insurance works for most Americans. So we're going to go over those two things. There's also a handout that we're going to use at some point, and I'll show you that in a little bit. And at one point you will pause this so that you can watch a link that reviews vocabulary in case that you struggled to understand it as we went through it today. Okay, so first I'm going to start with what insurance is, just kind of broadly. Insurance is a program that requires a group of people. You can't just have a one-person insurance thing. You need a big group of people, and you can get insurance for a variety of things: your life, your home, your car, health, traveling, your phone, all sorts of things. And how it works is, in general, so these are the basics before I incorporate all the vocabulary, is if you want insurance, you join the group. And you essentially pay a membership due every month. So everyone pays in every month that wants this insurance. And you have to pay in. If you, for 2 or 3 months, don't pay in, then you're going to be kicked out of the group and you won't be able to get the benefits of insurance. So everyone pays into this pot. And the idea is that everyone who pays in, if something happens to their home, to their life, to their health or their car, then they can use some of that money from the pot to pay for that thing. So everyone pays in, and then when it is needed for someone, they can pull out. Now, of course, around this pot, there's going to be rules to make sure that no one is abusing the system and to make sure that it is functioning. We can't have everyone pulling out money and run out. So there's going to be rules in place for how much you pay in and how you become eligible to pull out. So in this country, we've had health insurance in both sectors, public and private. So healthcare before Obama was already socialized in some arenas. What I mean is that the government collected taxes and provided the health insurance for people on Medicare and Medicaid, two programs born in 1965 under LBJ. So when you heard concern that Obamacare was going to socialize medicine, that was a misunderstanding because we already had aspects of our health insurance policies that are run by the government. And then you also have a few other programs. CHIP would be like Medicaid, but is for children. Stands for Children's Health Insurance Program. And then the VA provides socialized health insurance, and your public hospitals also are funded by government money through your tax dollar. And then a lot of Americans get their insurance by buying the policy. And that's really what I'm going to be focusing on today. You buy your policy through your employer. So remember how I said it requires a group to come together? That group has to come together and pay in. Your employer, what the employer does for you, is they represent you and your fellow employees as a group, and they get a policy from a private company. So they're going to contract with that company. Now, how it's paid for is somebody pays for it. Your employer might pay for it. Your employer might say, you know what, we can only pay for part of it, and the other part you're going to have to pay out of your paycheck. Or your employer says, look, we have contracted and we've gotten you this, but you're going to have to pay the full amount, and we'll pull that out of your paycheck. So many Americans pay for their health insurance. They just don't feel it because they don't write the check each month. It just comes out of their paycheck. And there is a tax perk to that because it comes out pre-tax. So here's some companies here in Texas that are pretty big: Humana, Blue Cross Blue Shield, Aetna, United Healthcare, and probably some more. So those are just some popular ones right here in Texas. Okay, so when you have health insurance, you of course need proof. So you get a health insurance card every year. So a lot of seniors get their health insurance card through Medicare. And the card looks like this. It has your name, it has your member ID number, it'll have information about what your policy provides. Medicaid and CHIP also have cards. They look very similar, same basics, your name, your member ID number, and some information about your policy. And then you can get health insurance through your employer, and this one is going to have, as you can see, the company name at the top, your name, your ID number, and some things about your policy. So when you go to the doctor's office for the first time that year, they're going to say, can I see your health insurance card? They're going to photocopy the front and back. What this tells the doctor's office is who to send the bill to if you're not paying for it. So doctor's offices need this. You can still go to the doctor without health insurance, and you'll have to pay out of pocket if they accept you. They might also not want someone that doesn't have insurance. Okay. Or they might not accept the insurance card you bring, so you got to call ahead of time. When they accept your insurance, that's called in-network. When the doctor's office hasn't already set up an agreement with, say, Blue Cross Blue Shield, and that's your health insurance, and you want to go there, you're going to be going to a doctor that they call, your health insurance company calls out-of-network. And your health insurance company may not cover so much if you're out-of-network. So Americans usually want to go in-network. So a little bit about vocabulary. That money I was saying that everyone pays in every month, that sort of membership fee, is called a premium. So every month you pay premiums to your auto policy, to a life insurance policy, to a healthcare policy. A copay is the flat fee that you pay when you go to the doctor's office. So sometimes your copay is pretty low, $10 or $15. It could go up to $20, $25. And your copay might vary depending on what doctor you're going to. If you're going to a regular doctor's office, a specialist, urgent care, and ER. But the idea is that you have to pay out of your pocket a small flat fee. Now the doctor's bill is bigger than that. And what the doctor will do is take the copay and whatever's left over of the balance. So let's say you have a $20 copay and the doctor's bill was $150. The doctor's office will send that bill to the insurance company, and the insurance company should pay the remainder. The idea with the copay is that it keeps you from maybe abusing the system, and so you have to pay a little bit before you can access that pot. A deductible. If you've had a car accident, you've probably become familiar with what a deductible is. The deductible is the minimum you must pay in a year before essentially your insurance kicks in. So let's say you have a deductible of $500 on your car. If you got in an accident and the damage was $800, you'd have to pay first $500, and then the insurance company would pay the remaining $300. So deductibles, if they're really high, people probably are not paying so much in premiums. You kind of notice this correlation. If your health policy has really high premiums, you probably have low copays and deductibles. Really low premiums, you're probably going to have a high copay, high deductible. Like I said, this is the basic vocabulary, but every health insurance policy varies on what the numbers are for these. Coinsurance. This is the idea that after you've met your deductible and you have some sort of medical bill, that you and the insurance company split the bill. So you don't just get to go to that pot and take out all the money for all your bills. You go and you have some sort of cost-sharing plan. So I put up here 80-20. The idea would be if your bill was $100, insurance would pay 80 of it, you would pay the 20%, $20. And so again, if you have a really high premium, you're probably going to notice you have great coinsurance, like a 90-10 split or a 100-0 split. And if you have a low premium, you're probably going to see something like 70-30. So the premium, you get what you pay for. Your out-of-pocket maximum, this is the maximum amount you have to pay in a year before you become eligible for a full 100% paid by insurance. So if you've had a really rough year where the medical bills have been piling up and you've been paying a lot of 20%, you pay every bill, you pay 20%, but it adds up to, say, $5,000 in the year. If it adds up to $5,000 in the year, and that's your out-of-pocket maximum, if you have any more bills in that year, now insurance will pay the full 100%. Okay. An annual maximum. An annual maximum is the total amount that insurance will pay. So kind of like how you have an out-of-pocket maximum, and when you hit that, insurance will come in and pay all the remaining bills. They too have their limit. You cannot go above a certain amount, or the insurance company won't pay above a certain amount in a year. Now, this one I still have up here, but the Affordable Care Act doesn't allow insurance companies to do this anymore. So the annual maximums and lifetime maximums have been eliminated. But I do want you to know that they once existed and that was a problem, because what it meant for a lot of Americans is at some point, if bills got too costly, health insurance would say, we're done. No more. You can take no more from the pot. And I guess on one hand, you could see that that would be hard to keep a system of insurance working if one person is taking all that money out of the pot for everybody else. However, usually someone is in dire life or death situations when they're needing this money, and these health insurance companies do work for profit. They do have corporate shareholders that are making money. So the Affordable Care Act eliminated these, and a lot of the justification was, how could insurance companies be making money for profit and then sort of abandoning people that might be in dire need and not covering those medical bills. Okay, so that's the basic vocabulary. Pause this, and there's a link that I'm going to have up that reviews all that basic vocabulary. Okay, so if you had trouble with that, you can pause this, watch that. You'll have someone else explaining it. Okay, so that was part 1 of healthcare. That was all the basics of the vocabulary. For part 2, I want to explore health insurance policy. So I'm going to show you some health insurance policies. You should have these papers in front of you. I'm going to pull them up on my screen and we'll go through them one by one.